former emergency room nurse, and so have practiced with lots of patients. So thank you for hearing this important bill. We support HB-1663 for 4 reasons. First, privacy is the foundation of freedom. Justice Louis Brandeis once wrote, "Privacy protects the right to be left alone." In the exam room, this means non-interference. Also under the Hippocratic Oath, a doctor promises to hold patient data confidential to ensure trust and frank conversations. Second, HIPAA does not protect privacy, as has been said here already. HIPAA is considered a permissive data sharing rule. According to a 2010 HHS rule, more than 2.2 million entities, including 1.5 million business associates, are permitted to receive individually identifiable data without patient permission if the covered entity chooses to share it, unless a state privacy law requires consent. That's why this bill is so important, and that's why it does not conflict with HIPAA. It will protect patients from the data sharing that's allowed by HIPAA without their consent. So please see the 22 HIPAA harms in your packet for more information. And I forgot to pass out, but yeah. Oh, you already did. Okay, thank you.
Yeah, we have them.
Thank you so much. Third, as we often say, he who holds the data makes the rules. Outside access to private patient data enables third-party control of the exam room using corporate treatment protocols, patient and doctor profiling, and penalties on doctors who go outside the protocols to provide personalized care to patients. HIPAA also allows medical records to be shared nationwide without consent through the eHealth Exchange, the nation's largest health information network, in which New Hampshire is mentioned 16 times in 16 entities. Fourth, medical records are digital gold. Optum Insights, the data analytics subsidiary of United Health Group, reported revenue of $18.9 billion in 2023. That's 29.8% higher than 2022, and all they do is health data. This access is through healthcare operations, a 400-word definition of 65 categories of non-clinical services. New Hampshire protects privacy rights through its state constitution and the state law that deems medical information to be the property of the patient. This bill adds details and guardrails to ensure that patients can exercise these rights. So please note the exceptions in the proposed bill allowing timely treatment and transfer without consent on page 4, line 24, and page 4, line 36. A lot has been said here about having to get consent and not being able to do anything. It's not true in this bill. Dr. David Brailer, MD, PhD, the first National Health IT Coordinator, wrote in 2015.
Please start wrapping up. Please start wrapping up.
I will just finish quoting him if I might.
Sure.
He said, he was the first Health IT Coordinator. He said, "You can't force a covered entity to give your data to someone you choose, and you can't stop them from giving it to someone they choose. Americans don't own their own health information, and access to it is controlled by others. It's time to change that." And we agree, and we're appreciative of this bill. Thank you so much.
Thank you. Questions? Representative Cushman. Representative Merchant.
Thank you, Mr. Chairman, and also thank you for taking the time to come all the way out here from Minnesota to a lovely state. And you actually did fairly well as far as the weather is concerned, so hopefully you brought it with you. We'll take all that you want. In regards to what I've asked prior individuals who testified before the committee, has your organization or someone that you know of done a side-by-side comparison to the state Minnesota statute versus New Hampshire statute that's being proposed here? And then number 2, is there any other state besides Minnesota in the country that has comparable protection for privacy?
Thank you, Mr. Chair and Representative Merchant. We have not done a side-by-side, but we have included for you in the packet the second page, which talks particularly about the consent provisions. In our law, we also have the decedent language. We have other kind of language, but this was particularly about the dissent, so that's what we included. We have had this law for basically 30 years, and have had, but haven't known any other state to have this kind of law. You will notice if you go to the Mayo Clinic Notice of Privacy Practices, that they will specifically say how the law in Minnesota is different, so that the Notice of Privacy Practices that Mayo Clinic has specifically says in Minnesota X, and about 8 or 9 different provisions because it's different protections.
Mr. Chairman, if I could? Thank you. Is it possible, or would you be willing to send the committee members a link to that Mayo site so we could actually find it and look through it for those who wish to do that?
Yes, Mr. Chair and Representative Merchant, we also have a copy of the Mayo Clinic form, and we would be happy, I think we only have 1 or 2, so we would be happy to have you just take copies of it.
Thank you. We can ask the researcher to make some copies.
Representative Kofalt.
Thank you, Mr. Chairman, and thank you for being here today and for taking my question. So can you speak a little bit to health information exchanges and the role that they play in all of this? Because I understand, again, this was one of the areas that HHS at a federal level exempted under COVID and authorized widespread sharing of information. So can you explain a little bit about the role of health information exchanges, and does that impact privacy, and if so, how?
So, Mr. Chair and Representative Kofalt, I would say there are 2 things at least that brings to mind. One of them is actually in the bill talking about Health and Human Services, and you will see that in the health information exchange language. We don't see anything in the bill that says for an infectious disease, when it's otherwise authorized by law, that information goes to the health department. I think maybe it was the health department here that I heard testifying about this idea that they couldn't have the regular exchange of infectious disease data. But we don't see anything in this bill that does that. And in Minnesota, we also have infectious disease data that goes to the health department. The health information exchange, interestingly enough, you might be interested to know that in Minnesota with our privacy law, we have specifically in our health information exchange that the health department cannot be part of it because they cannot see all the other data that's in the state health information exchange. Unfortunately, from our perspective, we were not able to stop the health information exchange because it is this broad sharing of data. The CHIS that she was talking about, that's what we call an all-payer claims database, and that is where all of your data goes to the government without your consent, identifiably, right? And so there are some things even in Minnesota that we're still working to stop, but the health information exchange in Minnesota, they can't access that exchange.
Other questions? Representative Cushman.
Thank you, Mr. Chairman, and thank you for being here and taking my question. So
Thank you.
is the only way then, perceivably, to not have currently the government, the all-payer claims database, the CHIS in New Hampshire, the only way to avoid them having access to your private health information is to not utilize services covered by insurance? Would that be true?
Mr. Chair and Representative Cushman, there was a case, Gobley versus Liberty Mutual, that limited the necessity for, I think it was, I'm pulling this out of my head here. I think it was prohibited employers from having to share this information on the all-payer claims database. And so I think it really depends on what you have in your state and then how that's been impacted by the Supreme Court decision for the self-insured employers, I believe is what that lawsuit was about. But yes, that would be the only way, if that's how it is in your state, that you could avoid all of the details of your health care going into the government, or paying cash and going to a provider in cash.
Follow up.
Thank you. And then could you tell me again, and the committee again, those page numbers that you were talking about in the bill that alleviate the concerns about transfer of care and delays?
Yes, Mr. Chair and Representative Cushman, page 4, line 24 talks about essentially the provider having a representation of holding a signed and dated consent from the patient authorizing the release, so that you wouldn't actually have to have the real consent at that moment, go to the patient. And the other one is line 36. These are the exceptions. In Minnesota, we call it break the glass. So the times where you can break the glass and get access to the data, and you'll see there it says for a medical emergency on A, but then if you go to B, it also says to other providers within related healthcare entities when necessary for the current treatment of the patient. And in addition to that, I think it's really important to look at the definition of provider, because I have heard a lot of the testifiers saying that they'd have to get every individual's name. It would have to be very specific to every individual practitioner, but that's not how we see the law written, and that's certainly not how it's written in Minnesota. So, whatever you want to pick, a very large healthcare system in this state, it's got a lot of different doctors, nurses, whatever in it, but you're giving the consent it can be to the entire institution, every doctor in it. It's not specific to one doctor, one share.
Thank you.
Representative Seth King.
Thank you, Mr. Chair. Thank you for taking questions. I'm a little confused on some things I'm hoping you can clear up for me. When HIPAA, if my memory serves me correctly, I was a little young at the time, but when HIPAA first came around, it seemed like there was a lot of opposition to it because it was too much regulation and it was going to really hamper the medical industry from basically doing its job. And correct me if I'm wrong, but if I had to imagine, Citizens Council for Health Freedom probably would have been against HIPAA when it was being debated originally. But now I'm reading your handout here, and it sounds like your biggest complaints with HIPAA are that it's too liberal in what it allows the industry to share within itself. And so it sounds like this bill and what you're promoting is like HIPAA on steroids. And I'm just curious how I wrap my head around the idea that on one hand, we're against HIPAA because it's too restrictive and it's going to rise up costs of the industry as a whole. But then on the other hand, we want more of that. I don't know. I could be very confused on this. If you could help clear that up for me. Thank you.
Yes, Mr. Chair and Representative King. So I think that given what you said about, the history of HIPAA, which was 1996, and the law said that Congress was going to, within 3 years, actually implement or enact their own privacy statute, right? And they had several hearings, but then they didn't. And the law said that HHS could then write the rule. So they wrote the rule, and it came out, I think, proposed in 1998 or 1999, and then it was finalized. But it wasn't finalized before more than 50,000 comments came in. It was like a record comments of people opposing it because it took away their consent rights. And so actually the Clinton administration reversed for the final rule, and the Clinton administration put in consent for payment, treatment, and healthcare operations. They put it back into the final rule. Then President Bush was elected, and the industry came to the Bush administration and said, please take that out. And so the rule was opened up, and the consent provisions were removed. And so we do not have consent today for all of the sharing. And just like Dr. Brayler said, you can't stop them from sharing it with whomever they want. And, you know, the definition of healthcare operations, I mean, 400 words long, it's like everything in the kitchen sink, and they have nothing to do with giving care to a patient in those healthcare operations. And so I'm not positively sure how you see the bill as giving more access to data when it actually gives the bill gives less. Yes. So that's what we support is consent. And we actually support opt-in, which is consent, versus opt-out, which is dissent. And I guess the other thing I'd say is, you know, you have a state who has said that the medical records are the property of the patient. And look at anything else you own. If it's your house, you don't give everyone else the key.
Follow-up.
Thank you for the follow-up. Was the medical establishment and were patients' privacy rights better protected before HIPAA? Was the world a better place before HIPAA?
Mr. Chair and Representative King. So privacy was protected before HIPAA. Like I've done the whole history of HIPAA, so I know everybody who wanted the data, right? They wanted the data, from governments to the data industry to health plans to everyone wanted the data, right? And so what HIPAA did was it allowed it to be digitized without patient consent. And then the 2009 law that mandated the electronic health record allowed it to be shareable easily without consent. And so these two together took away patients' privacy rights, took away their control. And I just remember, here's something that I think you can all kind of relate to. I remember talking to a physical therapist, and she said, you know, because of HIPAA and the electronic health record, I get to see everything. So I know that my patient has had this sexual disease and that sexual disease, and I know he doesn't know that I know it, but I do know it because it's all available to me because of HIPAA. So.
Representative Merchant, and then Representative Palmer.
Thank you, Mr. Chairman, and thank you for taking the question. I noticed in the handout that was provided to us on 20 HIPAA harms, at the end of it, there's a authorization form from the Concord Hospital. Could you explain why it's there so I can understand how to interpret the reason for it being there? Thank you.
Yes, Mr. Chair and Representative Merchant. We just thought we should look and see what's being done in hospitals today for sharing the information. And this seemed to be one form that's already there. I'm sure you've got lots of hospitals, but one form that specifically gives the patient the ability to share data and the back and forth. Looks like a back and forth form to us. And one that says disclose medical information, the other says obtain medical information from.
So from that comment, is it my then to interpret that this authorization form is a consent form and something you would support? Or the organization would support?
Mr. Chair and Representative Merchant, this seems to be quite a consent form. It's not a dissent, it's a consent.
Thank you.
Representative Palmer.
My question has been answered again.
Okay, thank you. Other questions? Seeing none, thank you. No other questions. Thank you very much.
Thank you.
I have a pin card here for, and I think Roger Gown, I believe it is, but it says Judiciary House Bill 1082, so I'm assuming it's just a misplaced card. I have no other pin cards for this bill. No one else has signed up to speak on House Bill 1663. I'm seeing no one raising their hand. On the blue sheet in the back, 15 people did sign up in opposition, and I'm sure many others signed up online, both for and against. With that, I'm going to close the public hearing on HB 1663, and I'm going to open the public hearing on HB 1067 and recognize the prime sponsor, Representative Reed. Is Representative Reed in the room? I do not